Good to hear it. All right. Well, hey, we have a special treat, folks. We are speaking tonight with the renowned Dr. Stephan Sinatra. He's a cardiologist and best-selling author of the book Heartbreak and Heart Disease, where he describes unsuspecting bad habits can weigh more heavily on the heart than we actually imagine, and as well as those common bad habits, but also some of the lesser-known ones, which we're going to talk to the good doctor about in just a little bit. And he's an author of many books, more than 40 years of clinical practice, research, and study. Dr. Sinatra also founded the New England Heart Center, where he became known as one of America's top integrative cardiologists by combining conventional medical treatments with for heart disease, along with complementary nutritional, anti-aging, and psychological therapies. Thank you for joining us, Dr. Sinatra. What a treat to have you. Welcome to the show.
Oh, it's great to be here.
Awesome. You seem very interesting from what your staff sent over as your bio. What really caught my eye when I was talking with your staff earlier was you tell people, if you want better health, to take off your shoes and wiggle your feet around in the grass.
Oh, yes.
And,
sure.
I hadn't heard that since I was in herb school, and one of my professors recommended that. Explain to the folks why that's real important.
Sure. I mean, one of the most important things you can do, especially in 2022, is to walk barefoot. I mean, the grounding and earthing movement started about, almost 20 years ago, and there's been about 25 clinical studies in the scientific literature which demonstrates the profound efficacy of walking barefoot on the ground. You see, when you walk barefoot, you're taking in what we call electrons from lightning strikes that strike the earth. Now, I live in Tampa, Florida here, and we're sort of the lightning capital of the USA. But lightning strikes the equator maybe 1,000 times, every few minutes. So the Earth is well, endowed with, these natural electrons. And when you walk barefoot, basically you're absorbing these electrons through your skin. There's a K1 point below your big toe, which attaches meridians all the way through the pineal gland into the brain. So basically, walking barefoot, you get all these physiological attributes that are so conducive to healing the body. We did research on blood thinning, for example, on heart rate reactivity or variability, which demonstrates that grounding resets the heart. It resets the autonomic nervous system. Like today, for example, everybody is, worried about the pandemic. People have experienced lockdowns, and look what's going on right now overseas, with the invasion. Right. I mean, there's a lot of fear going on and uncertainty. And what happens here is that the autonomic nervous system gets overcharged. And what grounding and earthing can do is, even when you're experiencing panic or anxiety or fear, the overactive autonomic nervous system needs to be attenuated. And the best way of doing that is put your bare feet on Mother Earth, because that will help to reset the overactive nervous system. That really causes a lot of, like I said before, anxiety, panic, despair, even depression. So it goes on and on. So grounding is free, and it's the best remedy I know of.
Yeah. Well, it calms you down. When you were doing your studies, did you find any difference between the surfaces you were walking on, let's say grass versus, sand, or didn't it matter?
Well, the best surface is a seashore. No doubt about it.
Right.
In fact, this is amazing. When I did the research, I was so enthralled by it and so convinced by it that in Florida, I ended up moving to the seashore. So I can literally, walk out of my condominium and really walk a few hundred yards, and I'm on the water barefoot, which is really amazing, because barefoot, when you walk barefoot, it heals the body in so many ways. Even as a doctor, it baffles my imagination as well, because there's so many elements that heal with the natural earth energy that it's just incredible.
Well, I know one of my herbal professors said you want to ground your electrical energy you have bent up in your system. And, because we have electrical impulses in our body, heart, brain. And so the best thing he said was to ground that. And if you get all uptight, he says people walk and live in high-rise buildings, drive, and if they walk to work, they're in shoes. He says, take them off.
That was a good professor. He was right on. I mean, that's good advice. That's really good.
Well, let's get to, since your specialty is cardiology, what advice can you give the folks here, some tips on improving heart health that, is very common sense, something they could do maybe at home, nothing too exotic or expensive? What would you say to somebody that's maybe in the midlife and want to make sure they don't have cardio issues?
Well, there's so many things you can do, but there was a recent study that really caught my eye. It was in the European Heart Journal, and it was a study that involved going to bed. In other words, what time is the best time to go to bed? Now, there's been lots of studies previously that demonstrate that 6 to 7 hours of sleep appear to be ideal. But there's never been a study to demonstrate at what time do you go to bed. Now, as a cardiologist, I resonated with this because you can imagine being on call day and night, through decades. I never saw my bed at night. I was up all night, treating people in the emergency room, ICU, CCU, cardiac cath lab, you name it. And when I read this article, it really penetrated my heart, I have to tell you, because the data was amazing. It had a subset of like 88,000 people. It lasted for about 5 years. And what it showed was that the ideal time to go to bed, in other words, if you went to bed between 10 o'clock and 11 o'clock at night, you were in the sweet spot. In other words, the ideal time where your autonomic nervous system gets reset. Your biochemicals like cortisol, adrenaline, noradrenaline are in an optimum state. And basically, going to bed at that time, you had less heart attacks and less death over this 5-year period. Now, this was particularly more germane for women, which really, caught my eye as well because, women and men are different when it comes to heart disease. That's why I wrote the book Heart Sense for Women, because, women and men are very, very different. But even in this study, there was a difference with women being the most vulnerable. So what I would tell your listeners or anybody listening to your program now is that if you want to help prevent heart disease, then when you retire at night, if you go to bed before 10, it's not good. If you go to bed, after midnight, it's not good. Between 10 and 11 o'clock at night are the ideal times. Well,
that kind of goes along with your circadian sleep cycle then, right?
Correct. Exactly.
Okay. Did you see that research from Rutgers University? I believe it was in 2012, 2015, somewhere in there, where they noticed that the thyroid manufactures a hormone the brain picks up as a neurotransmitter to regulate your sleep cycle, your circadian sleep cycle, and more importantly, your breathing when you're sleeping. So what they were showing was people at the sleep apnea sleep center had a thyroid out of balance. That's what they were showing.
Were they showing like low thyroid situations? Probably a low thyroid would contribute to that.
Right, and they also saw a correlation between thyroid disease and high blood pressure in people with, cardio issues.
Oh,
so
definitely.
I thought that was.
I mean, I've seen that for years. I'm glad you brought up the low thyroid situation because with the advent of electromagnetics in the environment, and I'm talking about cordless phone, cellular phone,
sure,
all these electromagnetics, computers, Wi-Fi in the house, all that stuff, microwave ovens, all this electromagnetic soup that we can't see, feel, or taste. These haphazard, chaotic vibrations do affect the thyroid. The thyroid is a very, very sensitive organ to electromagnetics. So, it just makes sense that, we're seeing a lot more hypothyroid illness, in the country, again, because of, the technology.
Yeah, I agree. And also I heard from an optic neurologist, they're worried about it for vision reasons, for the brain and eye health. So
yeah, retinopathy, no doubt about it. Even glaucoma. You know, one of the best things to protect your eye health. I just came across an article only a year and a half ago, because I'm writing I'm sort of the editor of a textbook of cardiology, so I was really adept on the medical literature, the most current medical literature. And coenzyme Q10 is amazing for the eye. It helps prevent retinopathy. You know, we've known that it helps prevent migraine headache, but when I read that it prevented glaucoma, that's something that I learned within the last year, which was, you know, something incredible, because I have a family history of glaucoma, and I've been using CoQ10 for 40 years, and I never even realized that, because I never saw that research before.
Oh, that's interesting. I hadn't heard that, but I'll pass that on to people if they ask. I do want to ask you now, based on all your knowledge and with the COVID isolation thing going on, that's really distressing a lot of people, multiple levels in their physical, you know, I guess counter their brain as far as emotional upset. There's a lot of people that are distressed emotionally as well. Anything that you can say other than, you know, putting your feet in the sand to help counter any of these isolation effects that are really disrupting our health?
Yeah, great question. And you know, the way I would answer that is, you know, COVID-19 has been a disaster, especially for kids, you know, young adults. I mean, the suicide rate has been astronomical. I mean, it's just been unbelievable. The divorce rate, the amount of rage that people, are faced with, and anger, because they're locked into society. And I would tell people this, the most important thing to do is continue to embrace your vital connections. In other words, your family is very important. Your friends are very, very important. And being outdoors, I think, in a pandemic situation is really the best way to go. And the reason being is because when you're outdoors, the chance of catching even very, very virulent viruses are minimized. I mean, incredibly minimized. Now, look, if you're in a stadium with 100,000 fans and everybody's screaming and hollering and somebody's sick, I mean, could that be a problem? Yes, it could be. In other words, you know, coughing and sneezing, you know, droplets can, you know, transmit, highly contagious viruses. But again, outdoors is really key. And you know, it's just amazing. People would be asking this to me, you know, all the time. You know, what can I do, Doc? And I say, look, do you have a dog? Walk the dog. You know, the dog can be grounded. You know, it's good exercise. Go outside. If you want to meet your friends or your neighbors, you know, go outside and talk, and just, you know, ride a bicycle, go walking. I mean, these are the greatest forms of exercise anyway. And you know, if you have grounded footwear, or if you're walking barefoot on grass or concrete, that's great. Just remember, asphalt will not conduct, you know, so if you're walking on asphalt, you won't get the Schumann resonance, which is really the humming of the earth, you know, and we can measure it. It's about 7.83 hertz. And you know what the Schumann resonance is? It's like you know, when the yogis say the word Om, the vibration of the Om is 7.83 hertz, which is really in the Earth's surface. So I would tell people that during the pandemic, get outside, walk barefoot as much as you can, you know, go to the beach, go to parks, you know, just, you know, experience the outdoors and get grounded, and you will get well, no doubt about it.
Right. You know, when I was just mentioning to our audience the first part of the show, they had a new study that animals will help delay dementia in people at least 5 years. So pets are very beneficial for the elderly to have. The other thing,
read that study. That's a great study. I mean,
isn't that great?
Yeah.
Let me see.
Was that recent?
This was Michigan Medical Center.
Okay, I'll Google that. Because, you know,
Dr. Tiffany Bradley. Pets will deter the mental decline of folks, is what they were determining.
You know, it's probably because pets offer so much unconditional love.
Right.
And whenever a person takes in that, you know, that love that a four-legged, you know, animal can give you, If you're taking that unconditional love heals everything. It's unbelievable.
Oh, I know. And they keep you active, That's the other thing.
Oh, that's right. Pets will keep you active. And by the way, you're talking to a dog lover. I mean, I've had dogs all my life, so, yeah.
Mm-hmm. Yeah, I love dogs too. Cats are fine, but I'm allergic to cats. So I know our engineer, Frank. Hey, Frank. He's a big cat lover. But, well, let me ask you this. With all that's going on in the world, COVID, the Ukraine blowing up, what supplements do you think we could take to help not only our cardio function out, but also, reduce our stress level?
You know what? What comes to mind immediately is melatonin. I really like melatonin.
Okay.
Especially during situations of high emotional stress where people aren't sleeping and people have fear and anxiety. And the reason why I like melatonin is melatonin and CoQ10 share common ground. And I feel like I'm an expert on CoQ10 because I've done so much research on it. But even when you go out in the sun, for example, your CoQ10 and your melatonin stores are utilized within like 30 minutes. I mean, CoQ10 and melatonin are the two most combative antioxidants against UV light. And with all the stress and anxiety and people not sleeping, people need melatonin. And again, even in COVID-19, there's been good literature. I mean, there's good articles in the medical literature showing that melatonin also combats viruses, even some of these malignant killer-like viruses that we're being confronted with today. So if people can't sleep, if they do have anxiety and depression, I would start with 1 milligram of melatonin. Then I would double it if they needed it. I would even go up to 5 to 8 milligrams of melatonin. And again, the usual doses are 0.5 milligram to 1 milligram. But again, in this world situation with a lot of panic, stress, and anxiety, sleeplessness is prevalent, and we need more melatonin going forward.
Okay, would you say use melatonin, or if you have another suggestion for a lot of the blue light that comes off all these devices and it really disrupts, I guess, sleep cycle and stuff? Is the melatonin?
Definitely.
Yeah?
Yeah, in other words, you're absolutely right. In fact, if people need computers at night, they probably should wear blue glasses, which filter out the light.
Right.
They're really inexpensive, and I use them at night, and it's a good idea. I mean, one of the best things to do is not to get exposed to too much electromagnetic energy before bedtime. And again, if you take the melatonin before bedtime, you'll be in great shape. And, while I'm talking about supplements, I love vitamin D. The data on vitamin D is awesome, especially in this pandemic. You live in the Oregon area, is that correct?
I'm in the Hickory, North Carolina area.
Oh, Hickory, North Carolina. Well, at least you're above Atlanta, and the people who live above Atlanta, for example, have less vitamin D levels than people that live below Atlanta, Georgia, because, like I'm in Tampa, Florida, I get a lot more sunlight, and when you get a lot more sunlight, you're getting natural. Remember this, when the sunlight hits your skin, it's the cholesterol in your skin that forms vitamin D3 with UV light. But vitamin D is a knockout punch against some of these killer infections that we're seeing. I like quercetin, Quercetin you can buy as a supplement. You can get them in onions. I mean, I think onions are one of the healthiest foods you can possibly eat. I mentioned CoQ10. I like zinc. I like probiotics. There's so many things that people can take as targeted nutritional supplements that can support the immune system going forward.
Sure. Well, what supplements would you target for cardio health off the top of your head?
Oh, I love CoQ10. That's number one.
Okay.
I like Dribose, especially anybody with, compromised left ventricular function. We call it congestive heart failure, or if people, have a lot of shortness of breath while lying down or ankle swelling. The combination of a teaspoon of Ribose 2 or 3 times a day with 100 to 200 milligrams of a good quality CoQ10 is absolutely incredible. If they don't do better on that, I add magnesium and I add L-carnitine. I call it my awesome foursome. In fact, I wrote the book Metabolic Cardiology, which is based on the whole aspect of using those 4 nutraceuticals. And I got to tell you, I've treated so many adults in my life, and unfortunately, I were a lot of children waiting to get heart transplants, and they were dying because they couldn't match their hearts. And I saw so many crying adults, parents in my waiting room, and a lot of those children I treated, even a couple of decades ago were still alive, and now they've actually refused heart transplantation because they got so much better on the metabolic cardiology approach.
Well, way to go there. That's great. Have you heard anything positive about hawthorn berries, like as a vasodilator action?
Well, yeah. I mean, I use hawthorn berry in my cases of patients with high blood pressure. In other words, if I can't get the blood pressure down with magnesium and omega-3 essential fatty acids and CoQ10, my next go-to is hawthorn.
Awesome.
I really like hawthorn. I use doses of about, 500 milligrams 2 to 3 times a day, and I've had some great success with hawthorn.
Oh, glad to hear that. Have you heard anything about motherwort for Afib?
I haven't used. I've heard about it. Afib right now is epidemic in society. A lot of it has to do to the thyroid dysfunction and a lot of the EMF in the environment. But usually, I've had great success with pharmaceutical drugs for AF. I have not personally used motherwort. I've heard about it, but I don't have any hands-on experience with it.
Okay. Well, where can our audience get more information about you, maybe where they can purchase some of your wonderful books? I believe your staff was telling me that you have a website, drsinatra.com. Yeah? Yeah,
that's the website that there's a lot of information on there. There's a lot of vitamin and mineral supports on there. And I have heartmdinstitute.com, which is an informational website, a ton of information. And then I have a healthy food website called Vervana, VERVANA.com. And by the way, I work with a lot of pets as well. I use CoQ10 in pets, we're agelesspaws.com. Ageless
Paws. Oh, very nice.
Yeah, we use a lot of salmon treats and buffalo and all that kind of stuff and turkey heart because a lot of those tissues have a lot of CoQ10. And I have to tell you, animals need CoQ10, especially dogs. An aging dog desperately needs CoQ10.
Right. Well, and you're also on Twitter, Sinatra MD, right?
I guess so. I mean, I don't know about that. I know I'm on Facebook and stuff like that, but anyway.
Right. Well, and what is your? I know pets. Getting offline here, but pets. They have a lot of food allergies. When I was growing up, I never knew pets to have them, but all of a sudden they have them now.
You got to be careful what you give pets. No, definitely. I mean, even foods even if they gave them like peanuts or something like that, they could die. I mean, pets are very fastidious when it comes to certain foods. So are horses. Horses, it's just amazing. I mean, you have to be careful what you feed horses. And again, dogs, cats, I mean, one thing about cats, though, which I think you can take to the bank, a lot of cats love seafood, sardines, it's very, very, by the way, sardines is one of the healthiest foods you can give a pet. Not only does it contain a lot of CoQ10, but it has a lot of anti-inflammatory omega-3s in it. And, pets get a lot of inflammation, and omega-3s are really needed by pets as well.
Well, got to look after our furry friends, don't we, Doc? We
Definitely.
do. Absolutely. Well, you've been a total delight. You've given us a lot to think about and also great tips on how we can protect our health and be more proactive. I want to thank you so much for joining us here tonight, Dr. Sinatra. And don't forget, you can find out more about Dr. Sinatra on drsinatra.com and tell him we sent you. Thank you so much, Dr. Sinatra. You have a blessed evening.
And you too. Bye-bye now.
Take care. Bye-bye. All right, folks, that was Dr. Sinatra, and he was very, very informative, lots of cardio information. Again, if you want to check out his books, he does have quite a few. He has many, many books, but basically cardio is his thing. So Heartbreak and Heart Disease is the latest one if you want to check them out, maybe on Amazon.com or some other places, and get empowered, right? It's all about taking that power back. So I'm really thrilled, for an MD to, embrace the nutritional part, Frank. It's so refreshing. I love that.